Which dog food do vets truly trust? Veterinarians see every tail wag and every upset stomach, so their recommendations matter more than flashy labels. Today we explore the best dog foods according to vets, why they choose them, what to watch for, and how to pick the right option for your dog. First, a quick fact. Vets often pick foods based on ingredient quality, digestibility, and clinical studies, not marketing. That shapes how they advise pet parents every day. Behavior check. When dogs switch to a vet-recommended food, many owners report better coat shine, more energy, and fewer digestive issues within weeks. Surprising insight: expensive doesn't always mean better. Some mid-range, well-formulated diets outperform trendy premium brands in vet clinical tests. Let's break it down. Section 1. What vets look for. Veterinarians prioritize complete and balanced nutrition verified by AAFCO or similar bodies, clear ingredient sourcing, named proteins, and avoid vague fillers. They watch for excessive byproducts, unnamed meat meals, and unnecessary dyes or flavors. Fiber, prebiotics, and soluble carbohydrates matter for digestion. Omega fatty acids matter for skin and coat. Specific life stage formulas, puppy, adult, senior, are important because nutrient ratios change with age. Section 2. Common top picks across clinics. Many vets recommend high-quality kibble with named meats like chicken or lamb, limited ingredient diets for sensitive dogs, veterinary therapeutic diets for medical conditions, and controlled calorie formulas for weight management. Brands that frequently come up in vet recommendations often invest in research, have consistent quality control, and offer prescription lines for allergies or kidney issues. Section 3. Prescription and therapeutic diets. For dogs with allergies, gastrointestinal disease, kidney problems, or obesity, vets often prescribe therapeutic diets that are clinically tested. These diets may use hydrolyzed proteins to reduce allergic reactions, novel proteins for elimination trials, or restricted phosphorus for kidney disease. Follow the vet's guidance closely because these diets are tailored to specific medical needs. Section 4. How to read labels like a vet. Start with the first 5 ingredients. They make up most of the recipe. Look for named animal proteins, whole food sources, and avoid broad terms like meat or animal byproduct. Check guaranteed analysis for crude protein, fat, fiber, and moisture. Ingredients like beet pulp, pumpkin, or chicory root often help with digestion. Notice preservatives. Natural options like vitamin E and C are preferable to artificial colors and BHA or BHT. Section 5. Real-life examples and why vets recommend them. Example 1. A poultry-based kibble with added omega-3s and probiotics is often suggested for itchy, dry-coated dogs. Example 2. A limited ingredient diet with single protein and carbohydrate sources helps isolate food sensitivities. Example 3. A renal support formula with reduced protein and phosphorus helps dogs with chronic kidney disease. Each choice matches a common clinical sign vets treat. Section 6. Wet versus dry. The vet perspective. Dry kibble is convenient, supports dental abrasion to some degree, and is calorie-dense. Wet food boosts palatability and hydration, especially for picky eaters or older dogs. Many vets recommend combining both or rotating textures depending on dental health and hydration needs. Section 7. Transitioning diets the vet way. Switch gradually over 7 to 10 days, increasing the new food by 10 to 25% each day. Sudden changes spike vomiting or diarrhea. Monitor stool quality, appetite, and energy. Call your vet if you see persistent GI upset, blood in stool, or severe lethargy. Section 8. Supplements, helpful or hype. Vets weigh supplements case by case. Omega-3 supplements and joint support formulas with glucosamine and chondroitin can be beneficial when backed by evidence. Probiotics may help some dogs with chronic digestive issues, but indiscriminate supplementation can upset nutrient balance or interact with medications, so consult your veterinarian first. Section 9. Budget-friendly vet tips. Affordable, vet-recommended options exist. Look for small batch or regional brands with transparent sourcing, or plain recipes with quality proteins and balanced nutrients. Buying in bulk or using subscription services often lowers cost. Remember portion control. Overeating is expensive and unhealthy. Section 10. Special populations. Puppies need higher calories and DHA for brain development. Senior dogs may need lower calories, joint support, and higher fiber for digestion. Large breeds benefit from controlled calcium and phosphorus to support healthy growth. Working or highly active dogs need calorie-dense, protein-rich diets. Pregnant and lactating dogs require nutrient-dense formulas to support pups. Section 11. When to see the vet about food-related issues. Persistent itching, chronic diarrhea, repeated ear infections, significant weight loss, or swelling after eating warrant a veterinary visit. These can signal food allergies, intolerances, or underlying disease. Your vet can recommend trials, tests, or therapeutic diets. Section 12. Myths vets want you to stop believing. Myth 1. Grain-free equals healthier. Not always. Grain-free diets can be appropriate for true grain allergies, but may be unnecessary for most dogs. Myth 2. Raw diets are inherently superior. Raw diets have risks, including bacterial contamination and nutritional imbalance when not formulated by a veterinary nutritionist. Myth 3. Homemade diets are automatically better. Homemade can be nutritious, but requires careful formulation to avoid deficiencies. Consult a vet or a board-certified veterinary nutritionist. Section 13. Success stories. A senior lab with chronic kidney disease regained energy and more comfortable appetite after switching to a vet-formulated renal diet. A terrier with recurring itch improved dramatically on a novel protein-limited ingredient diet. These stories show how targeted nutrition can change a dog's life. Section 14. A simple checklist vets use. Check life stage suitability, named protein sources, absence of unnecessary additives, presence of beneficial nutrients like omega-3s and fiber, and evidence of quality control such as recall transparency. Ask your vet for brand-specific advice tailored to your dog's health. Final thoughts. The best dog food is the one that meets your dog's age, activity level, health conditions, and digestive tolerance, and that comes from a brand with transparent sourcing and clinical oversight. Work with your veterinarian, watch your dog's coat, stool, weight, and energy, and be willing to adjust. Remember, small changes in diet can lead to big differences in health. Like, follow, and save this guide to feed your dog smarter today.